Hello, everybody. Are you ready to have, oh, just as I started, let's try that again. Hello. Are you ready to have your best slept self? I'm excited about hearing about that. I don't know if you are, but I will tell you if there's one thing I like to do, it is sleep, but I want to be able to sleep for a purpose. So I'm going to share something really, really, really huge right now about sleep. And I will guarantee that the things I'm about to share with you, you probably didn't know. You might have had a little bit of a hint, but now you can say, oh, yeah, I, I'm going to go look that up. I'm going to get some more information about that. So I'm going to share something with you that you probably don't know about sleep, and it's going to likely really change your mindset as it relates to sleep. And that is the number one thing for you to have a better night's sleep. Now, I'm Dr. Virginia. I'm actually a double board certified psychiatrist and a lifestyle medicine physician. I was going to say provider, but lifestyle medicine physician. And I have helped many, many, many people deal with sleep issues, sometimes primary insomnia or sleep difficulties, but more often than not, another related condition. It usually falls under the mental health category, sometimes primary health category, like depression or PTSD, or yes, even ADHD. You would imagine that there might be sleep issues with that. Autism, that's another one. So we're going to talk about all of the things that I've learned from working with a variety of different types of patients, and almost pretty sure that everything that I'm going to share with you right now doesn't matter what your diagnosis is. It doesn't matter if you're a patient or not a patient. It doesn't matter if you have a history of mental health concerns or not. If you sleep, this is for you. So let me go step by step because I want you to really understand the significance of the next three things that I'm about to tell you. Again, it does not matter what type of person you are, your body habitus, male, female. The things that I'm going to share in these next few moments with you, 10 minutes, less than 10 minutes. It applies to every human. Okay, I can't say it applies to every animal on earth, but I can definitely say this applies to every human. So pay attention, sit up, pay attention. It's time to work. Okay, number one, did you know that one of the most common and most popular natural remedies that you sometimes hear about being able to take into a bottle, it's melatonin? Did you know that you can utilize melatonin during the day? Yes, during the day, and it will actually help you sleep, sometimes better than if you take it at night. I didn't know that originally, but in my studies, looking at the research, going through this whole board certification process that I went through last year, I recognized that I kept seeing that in many different places, that it depended on when you took the melatonin, how best it might be for you. And usually I would tell people, oh, just take it about an hour before bedtime. That's what I had literally been taught for decades. Having written a book on depression, having worked with a master herbalist, it wasn't until I started again digging specifically for the lifestyle medicine program, because one module is just sleep, right? Now, sleep is a sleep doctor, that's all they do, right? That's all they do. They might have known this, but for the rest of us providers out there, most of us are going to tell you, even physicians, doctors, they're going to tell you to take melatonin at night. But more often than not, depending on what you're trying to achieve, you actually might need to take melatonin during the day, like when you first get up in the morning. I'm not necessarily talking about jet lag, you're going to another country or something like that. I'm talking about just you're in your regular old place in Nebraska, New York, Georgia, California, Texas, and you might need to take small doses. Yes, even smaller doses than we typically find in stores or in health nutrition programs, different shops. You may need to take a little bit less of a dose, but take it in the morning. It can make all the difference. Now, whether or not you're going to be better taking it at night, taking the morning, taking 0.25 milligrams, taking 1 milligram, taking 10 milligrams, that is going to be completely dependent on your evaluation, your health evaluation. So I am a board certified psychiatrist and I am a lifestyle medicine expert with including some expertise in treating sleep disorders. But I am not necessarily your provider. So if you're watching this and you're one of my patients and you're watching this because I asked you to watch something on sleep related to the way that we practice, then of course this applies to you. But if I'm not your individual, if we don't have a patient physician relationship, this is education that you get to take to your provider. And then you have a leg up when it comes to the conversation so you can have a more informed conversation about your body. Point number two. This, I think, is pretty huge. Did you know I knew this for a while, but did you know that we as humans have been running lots of experiments for many, many years? And in current ethical climate, we would not do any of these. But did you know that there used to be lots of experiments where we would sleep deprive patients? And I don't want to say we as a collective, we, because it was just psychiatry. I want to say we as in physicians in general, right? MDs back in the day, in the late 1800s and such, would do this, in early 1900s. If I sleep deprive you long enough, I can guarantee that I'm going to cause a mental health issue. I'm going to cause a mental illness. If I sleep deprive you long enough, I'm going to cause you to begin experiencing psychotic symptoms. You're going to see things or hear things or become paranoid or have delusions, this fixed false belief that something bad's going to happen or someone's out to get you. And or I can cause symptoms of mania. So you think about bipolar disorder. There's a whole another talk on bipolar disorder and psychosis, but that can happen, yes, in the context of lack of sleep. So the body and all of its wonderful creation has a fail-safe because the body is there for the most part to protect you. Yeah, it can do some things, autoimmune, some other things. Even diabetes is a protection. I love hearing Dr. Mir talk about this. Even the process of the sugar being shuttled in a certain way because your body can't handle the load, that's a protective mechanism. Okay, initially it's meant to give you time to kind of get it together. Same thing with sleep deprivation. Your body knows that, hey, if we don't give her sleep, she's going to have a really hard time. And I don't mean like a hard day. I mean like a hard time, like weeks and months. And in some cases, if we don't figure out what's going on, it progressed to years. That happened many, 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 many moons ago. So for you, I want you to remember that the body's fail-safe, don't forget it. Body's fail-safe is in 1, 2, 3 days, you're going to fall asleep. You're going to crash and burn. And this is where it sometimes makes doctors like me look really good. Because you come to me and you can't sleep. And I tell you, okay, try this. And you're like, oh, doc, that really didn't work. And then I say, try this. And you've tried all the things and you've not been sleeping. And then I give you something. And then you come to me and you say, hey, doc, that worked great. And guess what? It worked great for a month, 2 months, whatever, but it's wearing off. I think I'm developing tolerance. I might need something else. Go all the way back. The reason that it probably worked very, very, very well at the beginning, I'm not saying that a lot of sedative hypnotics aren't good, but if you didn't have a full sleep study or didn't have a full sleep panel, sleep inventory, if sleep wasn't the only reason you were coming in and we didn't do an exhaustive sleep evaluation on you, more than likely what happened is over the course of 3 days, you just crashed. Your body basically said, oh, she's gonna sleep. We're gonna make sure that she does, because if she doesn't, something bad could happen. She could become psychotic or become manic or have some other kind of a problem within the body. So the body is elegantly designed to constantly be protecting you. Your mind and all the other organs in your body are always looking out for you, always looking out for you. So because of that, after 3 days, if you haven't slept, guess what? You're going to go to sleep. That should give you some peace of mind. I know there could be oh, well, great. It might take 3 days before I fall asleep, but let's think about it this way in the bigger picture. You may have had many, many, many sleepless nights. You may have had multiple times that you were having difficulties because of PTSD. You couldn't sleep because of the nightmares or the flashbacks were keeping you up, or being very self-conscious and hypervigilant was keeping you up. After 3 days, you will sleep. Okay. The sun will rise again. Life will go on, and this too shall pass, and you should be able to sleep after 3 days. Now, there are a very minority of patients, worthy of House or Watson, that have certain conditions. Speaking of Watson, there was an episode where the patient had a genetic condition and could not sleep for days and days and days and days and days on end. That's a rare genetic difference, okay, or abnormality. Like I said, for the majority of us humans in the population, at least the rest of the 98 some odd, maybe 99% odd of us, after 3 days, we're going to go to sleep. So please take heart. If you feel like I haven't slept in days and I just can't make it another day, if it's been 3 days, you don't have to, because you are going to fall asleep. Okay. So please be encouraged by that. Please be encouraged by that. And you know that you're going to get really good sleep every 3 nights because of that. because your body just is not going to be able to push past that. And speaking of pushing past that, and speaking of reasons why it is that you might not be able to sleep, barring some, if it's when I see patients in my office, it really isn't some unusual genetic condition or genetic abnormality. Now, in terms of taking medicines, the way there's cytochrome P450, one of the liver enzymes, the way it metabolizes medicines, we know about that kind of genetic testing. Has been popularized since Dr. Mrazek from the Mayo Clinic started the pivotal research back in the day. Woo, woo, Mayo. After that, the world has been using it quite frequently, right? And so now you can get those kinds of testing done for a minimal amount of funds. But you may not have to get genetic testing. You may just have to have a really good sleep inventory, someone that takes the time. If you say my primary issue is sleep, let's tackle that sleep. Now, lots of times people will say it's depression, and we're going to go down the depression roadmap. But once I hear that your sleep's not great, guess what? I'm going to tell you to come and watch this video. And I'm going to say, I want you to start thinking about sleep. So when I send you an Epstein, fill it out. When I send you a Pittsburgh sleep inventory or sleep questionnaire, fill it out. If I send you any type of a questionnaire that might be related to sleep in any way, shape, or form, please complete it. If your doctor's sending you those things, there's a reason for it, because that's going to give us a little bit more information. It's going to help us out quite a bit to determine what the next step is for you. But there's a lot of comorbidities where sleep is an issue: PTSD, depression, anxiety disorder, for all different reasons. People don't sleep for all different reasons that I just mentioned. But I also have people where the sleep issue is a mimicker, meaning that it's not necessarily a comorbidity. It's that you think you're not sleeping, but it really is. You also have ADHD and you're taking your stimulant too late at night and then you can't sleep. That's a problem. Okay. And that means that you need to go and deal with the ADHD issues. See someone else in our clinic that does that, or see an ADHD specialist that does that. And then the sleep may come. In the meantime, if you notice that you've done all the things and you're still having a hard time, people are often hesitant to go to a sleep specialist because things can morph and co-occur and merge. I've treated people for depression and narcolepsy. I've treated them for PTSD and sleep apnea. Okay. They're not mutually exclusive. Just because I say, yeah, it's depression, doesn't mean that you don't also have sleep apnea. Doesn't mean that you don't also have narcolepsy. So this is why I will often still do a great workup and still send people over for sleep evals. It's not like anybody's failed. What it is I want to make sure that you get to the people that are going to be able to provide you with the best care within their specialty as possible. You got knee pain, I might send you to a knee specialist, but more than likely, somewhere along the line, you're either going to see PM&R, physical medicine rehab, or you're going to see an orthopedic specialist who, guess what, probably only works on knees. Because ortho is a great example of how to parcel out. Yeah, it can be annoying when you see you got knee pain and back pain and they send you to two different people instead of just having one orthopod or orthopedic person. But that is because those surgeons get very, very, very detailed about what they know about this particular area of the body. And that can be really helpful for you. Okay. So I hope that's been really, really useful for you. That was definitely less than 15 minutes. And for some of you, it was less than 10 because of the time that you joined. So my clock says 13. So definitely less than 15. So in 15 minutes or less, we went through the majority of sleep. So if this is where we part, I hope this is great information for you. And I want you to have a very blessed day on purpose. But if you're a patient that's in my clinic, I've got something a little extra special for you. And no, this is not going to be behind a firewall or a membership for now. It might be in the future, but it's not going to be right now. What I'm going to do is share with you the information on sleep that we utilize when we're in the office. And I want every patient to have gone through this because it's incredibly important. So when you are in our IOP program, when you're getting a procedure, and if you have one of these different areas, we will go through this slideshow with you. This is the lifestyle medicine portion, the 6 areas that we're going to be going was just to get some information, wonderful, you got it. If your goal as a patient was to sit and listen to this entire presentation, as I've said before, our presentations like this, they usually are 15 to 30 minutes, just depending on what it is and what we're talking about. The stress prevention tends to be a little longer because it's the beginning. The sleep one tends to be a little longer because there are many, 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 many more medications. And then substance abuse. If you ever watch the substance abuse one, that can be lengthy because, again, the number of medications that are utilized. So I hope this has been helpful for you. I trust that if you're a patient, you will do your work, you will finish your assessments, and you will have an idea about what your SMART goal is when you come in. The goal of the in-person with us is to refine your goal, not to start from scratch. It's to refine your goal, right? We're support. That's one of the reasons that when you email us support, because support is what I want you to hear. Not really help, more support, because what we're doing is we're coming alongside you and supporting you. We're not doing all the work because that's not our job. Our job is to support you in doing the work so that work gets done, you feel better, and you get to move on with your wonderful life and enjoy it. And that makes me happy. That makes all of our staff happy when you're able to do that. Okay, so this was how to be your best slept self. So go forth and sleep. Be productive when you wake up. Lose weight because the cortisol is low. Can't wait to see you. Have a very blessed day on purpose.